Alrighty, we have Miss Vivian Knock. She is a 60-year-old female that came in 4 days ago complaining of abdominal pain and nausea. And initially, the doctors were thinking that it was small bowel obstruction, but then when the surgeon went in to do the surgery, he found that she had stage 3 colon cancer. And right now, she is, I believe, post-op, day 0. She Some of her background is that she has a mother that actually died from colon cancer and a sister that is actively going through treatment for breast cancer. Her past medical history was diverticulitis, nausea, vomiting, and constipation. She has no known allergies. Her sodium was 132. This is abnormal labs. The sodium was 132, amylase was 180, and lipase was about 300. So something's going on with her pancreas. I'm not really sure what, but um, she doesn't complain of any pain where the pancreas would be. She's 800 times 3, appropriate for age. She does grimace when she moves, and she said that initially when she came in, I believe her pain was about 8 out of 10, and when she sits still, she has a pain medication, it's lower. But she says whenever she moves, it tends to go higher within that 7 to 8 range. So she is restless. She moves a lot. She has a husband, Thomas, they're married for 32 years, and her daughter, Donna, is 32 years old, who's divorced and has she has two grandchildren. Vivian, not Donna, Donna's two children. Um, some of the concerns that she was having was that she was afraid that she was going to fall within her home and have to go into sort of a long-term facility. She's also very worried about pain and pain management, um, and just is sort of a nervous wreck, and very, very anxious. I would probably say her anxiety is probably about an 8 out of 10. And so she's also worried about the colostomy care. She has a colostomy bag and is worried about the colostomy care, worried also about wound care, and also just worried that she's about to die. And so some of her vital signs were 140 over 80, her heart rate was 88, respiration was 24, her O2 stat was at 98, and temperature was about 98.9. Everything seems to be intact and fine. No real shortness of breath. She does have an IV going at normal saline for 75 milliliters per hour. She has an NG tube suctioning about 30 milliliters with dark green fluid. Of course, the nausea, vomiting. She's NPO except for sips of with medications. She's voiding with Pyramid, and she has a blanchable erythemic area on her sacrum with a Braden scale of 15, and of course, an incision on her abdomen from the surgery. Um, Her RRAT score was a 21, and we did some palliative screening for her, and we came up with the palliative care assessment would be a 7. Her ESAS score would be a 66, and her PPS score was about a 50%. And so some of the things she's being followed up by oncology, PTOT, dietitian, and ostomy wound care. And so some of the things that I am recommending that she does have a palliative care consult for a couple of reasons why. One is she's really worried about her pain. She kept on talking about, I need my pain medication. I'm just worried about my pain. And I think part of the worry about her falling is going to come from the pain. So I think palliative care would be great, especially if her disease progresses any further and with all the pain that a lot of cancer patients have. I do think that that advanced kind of pain management would be beneficial for her, as well as if she decided to not do the chemotherapy anymore, and because of pain, we can kind of just transition her back, or transition her into hospice if her prognosis is less than 6 months. And some of the things that I am going to recommend is that she keeps on with chaplain services. We need to find some social services for her see if because her daughter works and her husband works, see if we can get some sort of transportation to appointments or to the infusion clinics. We would also, she did talk about looking about advanced directives. So she has no full code right now, but maybe we can, give her the option of, hey, we can do full code on you, which includes CPR and ventilation, but there is the option of a DNR. Also, I would want to see if maybe do like a site consult on her as well, because she is so anxious and kind of depressed about this new devastating condition that I think maybe regulating with pharmacological aspects or non-pharmacological aspects that we can kind of control some anxiety and depression. So, and that's it.